Welcome to Knowledge Park. Types of endoscopy. Part 2. Nephroscopy. Path. Small back incision into the kidney. Situation. Very large or complex stones. Purpose. Break and remove stones under direct vision. Neuroendoscopy. Path. Tiny opening to the brain's ventricles. Situations. Hydrocephalus. Select tumors. Purpose. Create fluid pathways or remove tumors with minimal disruption. Capsule endoscopy. A swallowable pill camera maps the small bowel. Situations. Occult bleeding with normal EGD or colonoscopy. Suspected small bowel disease. Purpose. Capture images where standard scopes can't reach. Mediastinoscopy. Path. Small neck incision to chest lymph nodes. Situations. Lung cancer staging, certain infections. Purpose. Sample nodes unreachable by bronchoscopy. Thoracoscopy. Path. Keyhole ports between the ribs into the pleural space. Situations. Unexplained pleural fluid. Pleural biopsies. Lung collapse treatment. Purpose. Inspect the lining and treat inside the chest. Endoscopic ultrasound. EUS. Path. Endoscope with ultrasound pressed against the GI wall. Situations. Staging cancers. Assessing pancreatic cysts. Evaluating nearby nodes. Purpose. See through the wall and sample with precision. Laryngoscopy. Path. To the voice box. Symptoms. Hoarseness. Voice change. Throat pain. Swallow concerns. Purpose. Examine vocal cords. Look for inflammation, nodules, polyps, tumors. Nasal and sinus endoscopy. Path. Through the nose into nasal passages and sinuses. Symptoms. Chronic sinusitis, blockage, nosebleeds, loss of smell. Purpose. Find polyps, infection, or obstruction. Guide treatment. Togetherness. Airway trio. Airway. Nasal and sinus endoscopy. Laryngoscopy. Bronchoscopy. Digestive duo. Capsule endoscopy. Enteroscopy. Summary. Right scope for the right symptom. Precision to see, decide, and treat. Often in one session. Up next. Steps and what doctors see. Here's how your endoscopy works. Clear, step-by-step, followed by what doctors actually see. Preparation. For an upper endoscopy, you fast for several hours. For a colonoscopy, you drink a bowel cleansing solution. Follow your doctor's exact instructions. Consent. You'll review why the test is needed. Risks, benefits, and alternatives. Ask every question before you sign. The procedure room. You're made comfortable and connected to monitors for heart rate and oxygen. Your doctor. Nurse watching sedation and vitals. Assisting nurses. Sedation. Most people get conscious or moderate sedation through an intravenous line. IV. A twilight sleep. In select cases, general anesthesia is used. You won't feel the tube, you'll breathe on your own and remember little or nothing. The examination. The scope is inserted gently. For an upper endoscopy, a mouthpiece protects your teeth. Your doctor inspects the area on a monitor. Typical time, 15 to 30 minutes. Recovery. You'll rest about an hour as sedation wears off. Mild bloating or a scratchy throat can happen. You'll need someone to drive you home. At home, take it easy. Warm fluids can soothe your throat, and any gas from the procedure passes and settles. Why the bloating? To see clearly, doctors gently inflate the organ with carbon dioxide. Carbon dioxide, CO2, is absorbed faster than room air, so you feel less bloating afterward. Benefits at a glance. Minimally invasive. Quick recovery. High diagnostic accuracy. Seeing is believing. Many problems can be treated during the same session. Preparation tips. Follow instructions precisely. Review your health history and any relevant factors with your doctor. Arrange a companion to take you home and stay for a few hours. Ask questions anytime. Pro tips for prep day. Sip the bowel prep through a straw. Chill the liquid. Use a petroleum-based ointment to protect skin. During fasting, clear broth and gelatin help. What doctors see and diagnose. Endoscopy gives a direct view inside you. Color and texture of the lining. Healthy tissue looks smooth and pink. Doctors spot inflammation. Red, swollen areas. Ulcers, small sores. Polyps, growths that can often be removed immediately. They can pinpoint bleeding. Detect narrowed or blocked passageways. In joints, they see torn ligaments, worn cartilage. Most findings are minor and treatable, and catching issues early improves outcomes. Quick recap: prep, consent, sedation, gentle exam, brief recovery. Let's talk about risks. Calmly and clearly. For many, the anxiety before the procedure is the worst part. The unknown can be frightening, but the experience is straightforward for most people, and your team does this every day. Focus on the outcome, getting answers to feel better. On-screen low-risk meter stays in the green. Most people have only mild, short-lived effects. A sore throat after an upper endoscopy, bloating gas mild, cramping after a colonoscopy, drowsiness from sedation, a small bruise at the intravenous IV site. Serious complications are rare. Overall risk is low. These can include bleeding, especially if a polyp is removed, a perforation, a small tear in the lining, reactions to sedation infection or breathing issues. Your team is trained to prevent and manage these. You're monitored the whole time. Equipment is sterilized. A question that sometimes comes up is about infection from a previous patient. It's a valid concern. The safety standards are incredibly high. Every endoscope undergoes a meticulous, multi-step cleaning and high-level disinfection process in specialized machines between each and every patient. The risk of transmission of infection is vanishingly small because of these strict protocols. Your health history and medicines are reviewed in advance. If you have conditions affecting bleeding risk, your doctor will guide you on safe timing. After you go home, call your doctor or seek care if you have severe belly pain, a fever or chills, chest trouble, vomiting blood, black or heavy bloody stools, bleeding that doesn't stop. Endoscopy has an excellent safety record. For most people, the benefits far outweigh the risks. You're not alone. Ask every question you have. That's what we're here for. Most recover smoothly. Follow discharge sheet and call if worried. Was this video helpful? Share your endoscopy tips. Share your questions. What did you wish you knew about recovery? We read every comment. If you found this useful, please keep it respectful. Avoid sharing private details. Ultimately, the decision to have an endoscopy should be one of shared decision-making between you and your doctor. They recommend it based on medical evidence, and you have the right to ask all your questions until you feel comfortable and informed. You are an active participant in your own healthcare. Think of your body like a car. If a warning light comes on, a mechanic doesn't just start replacing parts randomly. They plug in a computer to see exactly what's happening. An endoscope is that computer for your body. It's a diagnostic tool that gives precise information, so the fix can be just as precise. This video isn't medical advice. Always ask your healthcare provider about your specific situation. If you're still uncertain after talking to your doctor, it is perfectly okay and within your rights to seek a second opinion. A good doctor will never be offended by this. It's your health, and you deserve to feel 100% confident in your care plan. Another specialist can confirm if an endoscopy is the best next step for you. So, think of your symptoms like clouds obscuring the sun. They make everything unclear and worrying. An endoscopy is like a gentle wind that blows those clouds away. It doesn't change the weather, it just reveals the clear sky underneath, allowing you and your doctor to see exactly what you're dealing with. And with that clarity, you can finally step forward into the light of a diagnosis and a path to feeling better. Your journey with this doesn't end when the video does. Be a proactive partner in your health. Write down your questions before your appointment. Bring a notebook. Bring a family member to listen with you. You are the expert on your own body, and your voice is the most important one in the room. Remember, your endoscopy team has done this thousands of times. What feels like a moment of anxiety for you is a routine, carefully orchestrated procedure for them. You are in very safe hands. If this helped, like, share, subscribe, and tap the bell. Thanks for watching. Wishing you clarity and confidence ahead.